All right, here we are with second part of fever. We're going to move into the actual physiological issue of fever as it's compared to being sick, and sometimes there's undetermined origins. So the first day you feel so cold, it's the worst, you're shivering. Why does this happen? Do you know? When we ingest substances that make us sick, viruses, bacteria, whatever it may be, they send substances which go to the brain, which tell the brain that we're getting sick. And our hypothalamus will reset our body temperature to be at a higher point. And the reason it does that is because it's going to want to bake those substances out. So if we reset it to a higher point, there's a little lag time where our body needs to catch up with that. And during that time, if our normal temperature in our brain and our hypothalamus is 100 or 102, the body being at 98 thinks, oh my gosh, I'm really cold, until we can get that fever up and we release substances which cause that. I'll talk about in just a minute. Then the next couple of days you're sweating to death, and this happens because your temperature is up, your body's raised that temperature above normal, physiological normal, so it can bake those substances out and try to fight them off. So fever is really a good thing in small amounts. Now, the mechanism, so here we go into the physiological descriptions. So let's go down to those exogenous pyrogens first. Those are the external infectious agents that enter the body, and they will stimulate what are called endogenous pyrogens, okay? So viruses, bacteria, whatnot. And those endogenous pyrogens, we bump back up, are actually released from cells in our body called monocytes and macrophages. You should remember that from blood. They help our immune system. Those endogenous pyrogens will travel through the blood up to the hypothalamus, and the hypothalamus will reset our normal resting temperature at a higher level so we can start to try to destroy those substances which have gotten into our body. Now, these endogenous pyrogens are known as interleukin-1 and tumor necrosis factor. Those are two of those. Those are the best known. There are tons of them. Those are the two basic ones that we will talk about. Now, prostaglandins facilitate this process. Prostaglandins are also substances that are released from cells that will go into the bloodstream to create a lot of different physiological responses. In this case, we're talking about them being released, going to the hypothalamus, resetting that normal resting body temperature at a higher amount so we can raise our body temperature to fight off infectious agents. Now, drugs such as aspirin, acetaminophen, Motrin decrease the production of those prostaglandins, which will decrease our fever. Okay, pyrogens actually mean to produce fire. Okay, so in Greek, and any substances that will raise it, such as a bacterial toxin. Okay. Increase of fever will increase phagocytosis and immune functions to fight off and destroy those infectious agents. Also, antigens may reproduce more slowly at high temperatures. So we do have that role of fever to fight off those little buggers. Okay, now here's the harmful effects of fever. Every 1 degree rise in temperature causes a 13% increase in oxygen consumption. You can do that on your own. You know, if you go 4 degrees above, multiply 13% by 4, you're going to have, almost a 50% increased oxygen consumption. And this happens because our metabolism will rise as our temperature rises. And as metabolism rises, we need more oxygen and glucose to create more energy to keep that metabolism going. Okay. This is obviously going to stress your heart because your heart is going to have to pump more blood out to the body to provide more oxygen and glucose with this increase in metabolism. And this is why a fever is so dangerous with people with a heart problem. Now, peak of 105, I said this in the previous video, I get nervous above 103 and I start taking something. If you start to get above 105, 106, you can have brain damage. Once again, because of the increase in the metabolism, you're going to also have that increased stress on the heart. You're going to be using a lot more oxygen, and also the brain needs a ton of oxygen. So if the body is using it, you might not have as much oxygen to feed the brain in its physiological processes. Fever during pregnancy can also damage the fetus. You want to be cautious with that. And over 106, people may need emergency care. They can have brain damage. Febrile seizures can happen with higher temperatures and fevers with children. They go into convulsions. Some may have an underlying neurological problem and continue as they get older. A lot of children just have it as they're young. And I don't want to say it's normal, but it's something that they outgrow. I had a friend whose child had this and was totally freaked out at first, but, realized after a few visits with the doctor, not that it's a completely normal thing, but it's not something that's going to damage them. But as you guys know with seizures, it's a scary thing to see, especially if you're not used to it. And they can go into that tonic-clonic phase. These are not seizures like we've seen with grand mal seizures. These are smaller seizures with the, well, I shouldn't say that. I mean, I suppose they could be more aggressive as well, but they won't be a continuing problem as we see with those grand mal seizures. We'll go over grand mal in the future if you don't remember. Fever of undetermined origin, 101 degree fever for 3 weeks or more. No diagnostics show any known cause. Careful follow-up tends to show in the future there's some sort of underlying infection. I saw this in a patient of mine who ended up having a malignant tumor in her lungs, and she would have these peaks of fever that would just go away. She also had rushes that would come and go, and it turns out that she ended up having cancer. Autoimmune diseases may cause this, and infections of some sort may cause them, of course, as well. We can take aspirin, Tylenol, cool baths, cool cloths on the forehead. If you cool down the arterial supply that's already in the forehead, as it starts to go back through the veins, that cool blood in the veins will actually cool the arterial blood coming up to the brain. It's pretty cool. Drugs will block prostaglandins in the body, which will stop their effect on the hypothalamus, which will slow down that increase in temperature and lowering that body temperature point back to a normal or closer to 98.6. Ray's syndrome is rare but serious. It can cause swelling in the liver and the brain. Most often will affect children 19 and below. You can get confusion, seizures, loss of consciousness. A lot of people don't know about this. I remember, and I said this on the previous video, that my grandmother used to just give me chewable aspirin. Remember those orange chewable aspirin when we were young? And I turned out okay. I'm not telling you to do it, but I don't think it's super frequent, but it can happen. So you want to be cautious. You don't want to give aspirin to children under 19. Anyway, you could read through the rest of that on your own. And that is fever in a nutshell. It's pretty short and straightforward. I will go over healing, I believe, is in the next video. Of course, as always, if you have any questions, reach out. Feel free to shoot me an email. I'll get back to you as soon as possible. Thank you, and have a great day.